everybody. I'm your host Rajni Bharara, and today I have with me on our show a very special guest. Her name is Dr. Neha Khatod. She is a gynecologist, and today on the show we are going to speak with her about UTI, which is urinary tract infection. I am going to ask all the questions that you have in your mind regarding UTI to Dr. Neha. But before, let's welcome her to SCube TV. Hello, Dr. Neha. Welcome to SCube TV.
Hello, Rajni. Thank you so much for giving me this opportunity, and I am very much excited to join this session.
I mean, we are excited to have you, firstly. And now, Dr. Neha, without wasting any time, like I mentioned in the beginning, that today's topic of discussion is going to be UTI, which is urinary tract infection. So let's just discuss the discussion with my very first question. My first question to you, Dr. Neha, is if you can please talk about what actually is UTI. I mean, the full form of it is urinary tract infection, but what actually is urinary tract infection? If you can please explain it to our audiences.
Okay.
Yeah.
So everyone knows in common language, urinary tract infections, we call it as UTI. It is the
Mm-hmm.
infection of the urinary tract. The urinary tract, it is comprised of two kidneys, ureters, bladder, and urethra.
Mm-hmm.
Ureters, what is their function? The function of ureter, it is to bring the urine. It is a channel which bring the urine from kidney to the bladder, where it is stored.
Mm-hmm.
And when the threshold of bladder is reached, we feel the urge to urinate. And urethra, it is the opening of the bladder to the external
Mm-hmm.
through which urination occurs. So anywhere, if there is any microbial invasion throughout this tract, anywhere, it causes the inflammation of the urinary tract and it can lead to urinary tract infection. The
Mm-hmm.
symptoms which frequently we encounter are dysuria, that is the painful micturition, burning
Mm-hmm.
during micturition, suprapubic pain,
Mm-hmm.
backache, and also frequency and urgency of micturition.
Mm-hmm. Okay. But Dr. Neha, the question is when the burning happens, when the burning sensation happens and it feels like you want to pee, but the pee or the toilet doesn't come out. It feels like you want to pee bad, especially it happens to the women. So, but because of the burning sensation and it is unbearable at times. And I think most of the women have gone through it because of the hygiene problem in our country. So because of the infection. So how do we treat that, and what do we do to stop that burning sensation? If you can please educate us about it.
Yes, the common symptoms which patient complains of are burning, micturition, and dysuria. The burning is very
Mm-hmm.
common.
Mm-hmm.
One thing, you should drink a lot of water,
Matlab,
plenty of
hydrate yourself.
yes, plenty of fluids. Then do not hold the urine for longer times, and
Okay.
please empty the bladder whenever you feel urge to urinate. And also
Mm-hmm.
avoid using the public toilets, but whenever it is necessary, we can't avoid like working women
Yeah.
or working in office. They have to use the common toilets. So
True.
practicing maintaining the hygiene, it is of utmost important to prevent
Mm-hmm.
the UTI. And for burning, if you feel any symptoms of UTI, you should consult your doctor. But meanwhile, you can what you can do at home, you can take plenty of fluids, you can take cranberry juices, and
Mm-hmm.
also urinary alkalizers. They are available in the market at chemist shop. That is the name of alkazol, citrusol, that you can take 2 to 3 times a day along with water. That can also
Mm-hmm.
help to relieve the burning micturition.
Okay, okay. But Dr. Neha, my question to you is also, if it happens, if this infection happens to you frequently, does it also cause, I mean, does it also have a consequence for the longer period? I mean, does it like take a form of a bigger disease for in the longer
Yes,
run?
yes, it can lead to the recurrent and chronic infection. So we
Uh-huh.
should not ignore the symptoms of UTI. It is UTI we can divide into the upper urinary tract infection and lower urinary tract infection. So lower
Okay.
urinary tract infection, it is comprised of the bladder and the urethra. and the upper urinary tract, it is comprised of the kidney and the ureters. So the mainly more common is the urethritis and the cystitis, which is seen more commonly in the patients, especially in the females. The females, they are very much predisposed to uh, acquiring urinary tract infection because there are two reasons. One is that urethritis shorter in the females, which is a predisposing factor, and again the urethral opening, it is in very much close proximity to the vagina and the anal opening. So it can get contaminated, and the infection, it can go by ascending route to the urethra, to the bladder, and it can cause urethritis and cystitis, in which the patient feel dysuria, burning, urgency, frequency, and patient feel that very intense urge to urinate. But when she goes to for passing urine, only few drops of urine comes out. So these are the common
Okay.
symptoms of urethritis and cystitis.
Okay.
Better is the
But
prevention.
yeah. Please go ahead.
Yes.
Okay. But Dr. Neha, also my question to you is, what are the major reasons for UTI? I mean, hygiene is the problem when the toilets are not cleaner, and the public washrooms with infections or with germs in it. But apart from that, what are the other reasons for getting this infection?
Apart from this, the other reasons being like unawareness, then drinking less water, especially during the summers, holding urine for the longer times, and
Mm-hmm.
also there is a predisposition in the females, honeymoon couples, and also during the pregnancy and in states of your decreased immunity, like
Mm-hmm.
diabetic persons, whose blood sugar levels are not controlled, or any
Mm-hmm.
neurological problems,
Mm-hmm.
any stones in the urinary tract.
Okay.
These are the other reasons for urinary tract infection. And if we ignore the symptoms, and if recurrent infection occurs again and again, then it can
Yeah.
lead to the infection of the ureters, and it can also go up to the kidneys, which we call
Mm-hmm.
as it is pyelonephritis. So these are the consequences.
Okay. So sexual intercourse is also a prime reason for this infection, UTI?
Yes, in the newer couples
Mm-hmm.
who recently started the sexual activity,
Mm-hmm.
it can lead to the females, they are predisposed for urinary tract infection.
Okay, but I mean, many people know about, hygiene and not using public washrooms, and these all, these are the ways how you carry the infection. But not many people know about the thing that you actually have told right now, which is about the sexual intercourse thing. That, when you stated that the newly begin couple who actually have recently started the sexual activities, so they generally get these infections. So for them, I would like to know from you if you can please educate them about what should they do and how should they take care of themselves so that they don't carry this infection further.
Okay.
Yeah.
So for them, the advice is always clean before and after the intercourse, and
Mm-hmm.
also urinate before and after the intercourse. And it is
Okay.
always good to wash your intimate parts with clean water and wipe them
Mm-hmm.
down from front to back rather
Mm-hmm.
than from back to front. Because if we wipe from back to front, the
Mm-hmm.
infection which is around anal area, it can ascend up to the urethra. So
Okay.
always we should wipe from front to back.
Okay. Okay. Now, Dr. Neha, with this, I would also like to know, there are a lot of products in the market in the name of, for these things, for especially for the UTI thing, because, now that I think in the recent times, this infection has grown tremendously because people are traveling and so many things are using this public toilets. So I also would like to know from you. So a lot of products have come into the market. Some in the name of P Safe and these all things. So would you recommend it to your patients, or would you say that you should carry Be Safe with you, or because they might also carry some chemicals in there, those products. So would you recommend it, or is it safe for people to use?
No, it is not necessary, but you can use it. Like that sanitizer sprays, they are available in the market. You can keep it in your bag and you can use it using a public toilet or common toilet, which is very much necessary because we are spending a lot of time outside our home, at our workplace, and
Mm-hmm.
you can't avoid using common toilets. So we can use that
True.
sanitizer sprays. But the most important thing is to practice the hygiene, that is cleaning with
Mm-hmm.
water and wiping with a clean cotton cloth or any tissue papers, and wiping always from front to back. And other than these, you should drink lots of plenty of water, plenty of drinks. You should
Mm-hmm.
avoid caffeine, alcohol, sugary drinks. These
Okay.
are, and you should not hold urine for the longer times.
Mm-hmm. Mm-hmm.
You
Okay.
should
But
keep
also,
in mind with
yeah.
all these things. Okay.
All these major points. Okay, great. But doctor, also with this, you have already mentioned the remedies that one should use. As in, you have told that you should not hold your urine for a longer period. You should maintain the hygiene, and alcohol, and these medicines you have already told to the people if they go through a problem like this. But with this also, I would like to know from you that are there any home remedies? Being a doctor, I know that you would not recommend it. But even though, because there are so many things, medical things that are available in the kitchen. So, would you recommend any such home remedies that a patient can use if he or she is going through this problem?
Uh, Mainly, we suggest to drink lots of water,
Hmm.
especially water and cranberry juice. It is also recommended
Okay.
in lot many studies. It is found that the cranberry juice it is helpful in treating and preventing UTI. Not in the treatment, but in preventing UTI because it is seen that cranberry juice it prevent that sticking of this bacteria to the urinary tract.
Oh,
The
okay.
lining of the urinary tract, it prevents the attaching of the bacteria to the lining of the urinary tract. So this cranberry juice, it is recommended. Other than these citrus juices, citrus fruits,
Okay.
vitamins, zinc, all
Vitamin
this
C.
you can take to prevent UTI. And other than this, if I can suggest you, you should not use that spermicidal and lubricating condoms also.
Okay.
For sexually active females, I recommend this.
Okay. 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 That's okay. You have told some great remedies, home remedies also. So now with this, my next question to you is there are a number of times when suddenly such problem occurs. So, I mean, with alcohol and things, are there any medicines in particular that one can carry in their bags if they are traveling, or if they are, out of their the homes or somewhere? And if they get these problems, so suddenly such problem occurs. So, is there any a medicine that you would like to recommend that one can carry all time?
No, I would not recommend to carry any medicines because in that case you should consult your doctor whether on phone or online consultation.
Okay.
You can take that alkazol citrusol to relieve the burning if immediate
Mm-hmm.
consultation it is not possible. So
Mm-hmm.
always you can do that online consultation. So in that case, doctor would recommend some tests like urine test or urine routine microscopy, urine culture, and he will recommend some empirical treatment for the time being. Then as soon as you come back, you can see your doctor.
Mm-hmm. Okay.
But
Okay.
finally,
So,
you should not take the over-the-counter medicines or any treatment which are research on the Google. You should not depend on the treatment for Google. You should always see your doctor if the problem persists or it is increasing or worsening.
okay, okay. So you should not go to when you get the sensation of burning and all these things, and if you get the infection. So yeah.
Symptomatic treatment you can take, but you should not take the antibiotics without doctor's prescription because
Okay.
antibiotic abuse again lead to the microbial development of the microbial resistance, and in that case, then antibiotics would not be effective then.
Right. Definitely. So for, I think not just for this particular disease or problem, but for any problem that people, randomly they go to Google, they Google the medicine and they go to the nearest medical store and chemist shop and they, take the medicine and have it. So you should not you avoid doing that, but rather go for online consultation or a phone consultation and consult your doctor for it. Okay. Great advice. With this, on average, what percentage of pregnant women develop UTIs? If you can, please also talk about this.
Yes. So UTI it is very commonly seen in pregnancy, and many women they have asymptomatic bacteriuria also. In that case, the patient is having bacteremia, but there are no symptoms. So
Hmm.
around 6 to 24% of the females they have this UTI during the pregnancy, and the
Hmm.
common reasons being decreased immunity and many anatomical and physiological changes they are occurring during the pregnancy,
Hmm.
which expose the pregnant females for UTI. So asymptomatic bacteriuria also the prevalence is 3 to 10% if we look into the studies. So prevention it is always better, and the females during their antenatal visits when they undergo antenatal screening, we do the urine routine and microscopy test to detect any asymptomatic bacteriuria. If their colony
Hmm.
count is more than 1 lakh, then it is and without any symptoms, so it is asymptomatic bacteriuria. And if there are any symptoms, so we should treat that and diagnose and treat them within time. Otherwise,
Hmm.
it can lead to that preterm labor, premature rupture of membrane, low birth weight babies, and in chronic renal failure. All this can happen if it goes undiagnosed during the pregnancy. So it is common because of this anatomical and physiological changes during the pregnancy, because it leads to the stagnation of the urine, and also
Hmm.
because of the growing size of the uterus, there is the pressure on the bladder and the urethra, which also again leads to the stasis of the urine in the bladder for longer time. So it helps in the growth of the bacteria.
Yeah. Yeah. Okay. But Dr. Neha, also my next question to you is, when pregnant women, develop this problem, so should they like treat it as a non-pregnant woman does, or is their treatment a bit different than the normal?
No, the common measures that we advise they are the same, but they should see their doctor, because many drugs they are contraindicated during pregnancy, so they should not take on their own. They should always consult their doctor, and they
Hmm.
should undergo their urine test to see whether there is bacteriuria, and urine culture and sensitivity also choose the best antibiotic for which the microorganism is sensitive. So always take that medicines under the doctor's guidance. Do not take on your own. And rest measures they are the same, like we advise for drinking lots of water, avoiding holding urine for longer times, and maintaining the hygiene. And all other
Hmm.
measures they are same.
Okay, okay. But my next question to you, doctor, is does men also get this problem? Does men also go through UTI?
Yes, men may also acquire UTI, and it is common, but it is common in their older ages. Like
Okay.
in some conditions like benign prostate hypertrophy, urethral obstruction, or like if catheterization is required for longer time, or catheterization is done during any surgeries or during hospital admissions,
Mm-hmm.
or any urinary stones. These are the predisposing factors for the men to acquire UTI. Otherwise, females are more predisposed, and they are more prone for developing UTI than the men.
Okay. Uh, so should men also cure it exactly how women does by consuming plenty of fluids and plenty of water and not holding urine for a longer time? How should they
Yes,
treat it?
these are the common measures, but again, he should consult his doctor. Like some
Mm-hmm.
sexually transmitted infections, they also have the symptoms of UTI. that urethritis, cystitis, they are also common with some sexually transmitted infections also. So
Mm-hmm.
better to see your doctor and have physical examination and the routine test which we advise for the suspected UTI.
Oh, okay, okay, great. So, Dr. Neha, before I let you go, my last question to you is: are there any, questions that you come up with regarding UTI that most people have a wrong, preconceived notion about it, a wrong, a thought about it that you would like to clear right now, and you would like to say that do not believe in this, but rather go for this?
Many women, they ask for using that special female that cleansers that are available in the market to
Mm-hmm,
wash the intimate parts. So I would suggest that use only clean water for washing your intimate areas, and
mm-hmm,
always clean the intimate areas dry. Always wipe it down after cleaning. Do not leave it
okay.
damp. And that is avoid wearing the tight fitting jeans or tight clothes.
Mm-hmm,
Rather than you should wear that loose fitting with cotton and airy garments which allow the air
okay,
to pass. So because
okay.
again it will lead to the development of UTI, and
Mm-hmm,
so you should avoid using that any deodorant or scented or that is specialized female cleansers that are available in the market. So
mm-hmm,
it will not help actually. It will not help actually. It will only predispose you for some other infections because it will disturb our normal flora of the vagina. And again, if the
yeah.
normal flora of the vagina is disturbed, then it can lead to UTI and vaginitis also.
Mm-hmm, mm-hmm. So you should be very careful about the kind of clothes you wear during these problems, when these problems occur. So the kind of clothes also matter a lot. So
Yes,
it
it
should be
also
cotton.
matters.
Okay.
Yes, you should be cautious with it.
Okay. All right. Thank you so much, Dr. Neha, for clearing out all the questions and all the confusion that we had regarding UTI and answering it so brilliantly. Thank you for coming to the show and taking out time. It was lovely chatting with you.
Thank you so much, Rajni. Enjoyed the talk with you.
Yeah, me too. Likewise. All
Okay.
right, guys, that's it from SCube TV. Keep on watching and do subscribe to the channel.